Hi everyone, this is Neel Raithatha, consultant audiologist and director of WAXscope. Thank you for joining me in another video using the WAXscope, which is now officially launched as of yesterday, Friday the 12th of April 2024. And also yesterday we held our very first training course using the WAXscope. And I just want to start off by thanking the most amazing set of specialists who attended yesterday. Not only were they really top class clinicians, professionals, but they're the most genuinely nicest people you can ever meet. And I'd like to think that I've made 6 new friends. Now, some of the specialists that attended yesterday already know, so we're already friends. But for those who, it was the first time I met them, it was a privilege and an honour, honestly, from the bottom of my heart to meet you. And you just made it the most amazing, special day. And you've all got my private numbers now, so you can message me anytime, give me a call. I'm always here to help and support you. And I just wish you all the very best in your journey now using the WAXscope. So what did I learn from yesterday's training course? So I learned that training is definitely needed using the WAXscope. Now, all of the specialists that attended were already very experienced earwax removal specialists performing earwax removal using head loops, head-worn microscopes. And with the WAXscope, it's a slightly different approach to removing wax. So there is definitely training needed. In comparison to the endoscope, however, it was just much easier to train specialists. At first, specialists just needed a bit of time just to adapt to the way of holding it and how to insert the instrument into the ear. Once they grasped that technique, and it didn't take long for any of the specialists, they really excelled. And I'm not just saying that, I saw progress in each and every single one of the specialists, and it was a remarkable transformation, actually. They just grasped it very quickly. I don't think it helped that I was sometimes in the room, because a lot of people found it quite nerve-wracking when I was there watching, in a nice way. So we're having a little giggle about that, so maybe smile a little bit. And it's just because I'm kind of I just want for everyone to do the best they can, and I'm very technical when it comes to certain things, which I think everyone appreciates in the end, because they know I'm doing it for their benefit. You can see I'm kind of laughing whilst I'm saying that, but no, it was well done. I hope the specialists are watching this, and I truly believe in each and every single one of you. I think you're going to do amazingly well. Also, I just want to thank a lot of people. It sounds like an Oscar speech, but I just have to, because there's so many people involved in this. Especially Darmister, who's my WAXscope business development manager, and Tracy, who's the Here Clinic's clinic manager. They've seen how much it's taken out of me to get this launched, and it's been a tough couple of years, especially the last couple of months has been quite tough. But without their support, I'm not sure whether I'll be able to have done it, if truth be told. The last couple of days especially, I've been really doubting myself, thinking, what have I done? Is it going to work? And a lot of the specialists who attended yesterday had a bit of a go at me, saying, you're the only one talking negatively about the device. They all loved it, which is great to hear. And also to my fellow trainers who came yesterday, Darius, who's an ENT surgeon, and Kaz, who's a brilliant audiologist, a senior audiologist. They're not only colleagues, but they're like family. And again, they've just been reassuring me, Neil, everything's going to work out fine. They've said some brilliant. They've been using the device for a while now, and it says there's nothing really more you could do to overcome the limitations of all of the techniques. And so, stop being hard on yourself. And I just want to thank my mum as well. Mum's been really supportive, and she's seen everything that it's been going on in the last few years, and to get it to this stage. So yeah, I just want to thank everyone, really. So with this particular case, initially, to treat the left ear first. So the specialists were watching yesterday. So what I did, I started off with microsuction, but it was quite dry and hard. So I went to the bottom of the ear canal trying to lift it, and I just reduced the exposure because it's quite reflective. A bit like how it is here, but I can manage with this. But on the left side, it was quite bright and reflective, because you had a lot of skin like this covering the whole entrance. And once I removed that outer layer, and I removed that last bit off the eardrum, or near the eardrum, I increased the exposure afterwards. But this is the view the WAXscope can give. You can see the level of detail. And this patient has got quite a narrow bendy ear canal. And I explained to the specialist yesterday, no device can change the anatomy of the ear. We can manipulate the outer third, the cartilaginous portion, because that's semi-flexible, but to a certain degree. There's only so much you can manipulate it and straighten it and dilate it. So there is going to be cases where it's going to be difficult, particularly bendy, narrow, twisty ears, and the wax is in the anterior recess. And I think that's where the endoscope is in a league of its own. Once you're comfortable using an endoscope, you can actually position an endoscope to look at every part of the ear. When you use a speculum, it's just not always possible. Now, just give you a quick backstory with this patient. They actually was treated 3 times by a private hospital. Now, no, they didn't see an ENT consultant or an audiologist at this private hospital. Now, I don't want to dwell on it too much, but this particular hospital, I've trained some of their admin staff, clerical staff, to perform earwax removal. And this patient found out afterwards, found me on YouTube, and as you can see, within 5 minutes, was successfully treated. So I wouldn't say it's a really straightforward case. You have to use a bit of instrumentation there, but it was one of my probably easier ones. And you can just see the view of the eardrum now. With this particular ear, the cartilage was quite malleable, so I used the medium-sized specular. Otherwise, I would have resorted to the slightly smaller specular. But I hope you enjoyed that video, guys. Again, a big shout out to all the specialists yesterday. You were truly amazing, clinicians, but also people. And there's a picture coming up now of all of us there. That's Max to the left. You have Sita next to him, sitting on the stool. You've got Joe, who's sitting on the ENT chair, and you've got Paul in the back, next to Matthew, who's all suited and booted, who I call Mr Audiology. To the right of him, sorry, you've got Rebecca, and you've got Kaz, who's one of the trainers, and I would say a friend, but also a family member. And just behind my ugly mutt, you've got Darius, the ENT consultant. So a big shout out to you all. You all did really well, more than well. You did remarkably well, and let the journey begin. Bye.